And while we're waiting, if folks have questions you want to start entering into the chat, we can make sure that those are covered as we go. Some might be covered in the introduction, but you may want to get those written in as well.
Perfect. Great point. Our group should know how to utilize the chat feature in Zoom by now. We've been virtual since March, so we're excited to host the hospital and your potential partnership here on the Ports Young Professionals Zoom. We're going to be sharing this afterward with our audience as well. So if there's a question that you want to ask and you don't want it shared with the 2,500 on our email list, you guys may want to think about how you ask certain questions, because we are going to share this publicly. Just a disclaimer there. So we're very excited to do this. I know we have, you guys are going to give us some information, and then we may have some follow-up questions as well. But I'm Jenna. I've been running the Ports Young Professional groups for 11 years, and this is the exact type of opportunity that we're looking for to keep our members informed, but also we're hoping that this information reaches beyond just our membership as well, that people are able to share this, and that we all kind of understand what's coming our way. So without anything else, I guess I'll go on over and turn it over to our former mayor, Spence Broadhurst, who's just going to kick things off and introduce our panel.
Well, Jenna, thank you, and thank you for having us, and thank you for the young professionals for doing this. Thank you for your interest. We're glad to be here. I am one of the co-chairs of the Partnership Advisory Group. With us on our panel today also is Bill Cameron, who is one of the co-vice chairs, Bill of the Cameron Companies, and also Mead Van Pelt, who's been a really active member of the advisory group. Mead is the executive director of the Harrelson Center downtown with a group of nonprofits. So we're really pleased to have them with us. We also have from Novant, our future partners, with us, Jesse Curtin, who's the Executive Vice President and Chief Consumer Officer, and also Shelburne Stevens, who is the President of Brunswick Health, Novant Health in Brunswick County. So we're glad to have them with us. What we'll do is I'm going to try to condense about 10 months of work into about 6 minutes, and kind of tell you where we started and where we are. And as much of how we got there as I can. Obviously, I can't count the hours that we've had the opportunity to put into this. So I will try to condense it. It's not my strong suit, but I will do that. And then certainly want to hear a few words from our friends at Novant, and then we'll open it to your team for questions and answer as many of those as we can, if that'll work with you guys. So, this all started a year ago, and the Partnership Advisory Group was appointed about 10, 11 months ago, and it's 21 members from the community, 5 members from the New Hanover Regional Medical Center Board of Trustees, 5 members from the medical community physicians, and then 9 members at large, which is the 3 that are on the panel today come from that group of just community members. And we came into this 11 months ago, just like all of y'all did, asking questions, trying to understand, really didn't know, I hate to say it, we probably all took New Hanover Regional Medical Center for granted an awful lot, and when we started having these conversations, we joined with the same questioning eye, maybe even a jaundiced eye of why are we having these conversations. And so we really got to work early trying to answer that question. And really we had 3 options put in front of us. One is to do nothing, just leave things as they are, move forward, which at the time, sounded okay, that's something we need to think about. A second option is some sort of governmental restructuring to give the medical center more flexibility. And a third is where we ended up, is a partnership and asset sale to a partner that could give us more flexibility and take us to a different direction. And so at the beginning, we started exploring all of those options. I'm a banker by day job, and I immediately went to the resource question, because we spent a lot of time as we were answering the question, as we were trying to answer the question of why are we even having this discussion. It became very clear that although New Hanover Regional Medical Center is an exceptionally well-run, financially sound institution, there are challenges on the horizon. And as we look forward to the next generation, it was very clear that we as a medical center did not have the resources, the human resources, the expertise resources, the technical resources, and behind all that, the financial resources going forward to deliver the health care through the medical center that all of you and our entire 7-county community deserve. So that became pretty clear. From a financial standpoint, you know, we looked at the strategic plan of the medical center, which was put together over the last several years by the Board of Trustees. And, you know, the crux of the strategic plan calls for taking health to the population as opposed to the population coming to 17th Street. You know, and getting into underserved areas and getting into more rural areas and really redeveloping how we deliver health care in a more efficient and a better manner for the community. Well, that had a price tag on it of about $1.5 billion with a B over the next 10 or 12 years to accomplish that. Internally, we as a medical center right now have the financial capability in the bond market to borrow about $150 million more than we have in debt now. The medical center has bond debt of about $350 million now. So we have the capacity to borrow another $150 million. And you know, the hospital is no different than your household, right? I mean, you have income and you have a certain amount of debt and you have to figure that out. Well, the medical center is the same way. We have the capacity to borrow about $150 million, which is 1/10, as you know, of $1.5 billion. So we don't have the resources and the ability to generate, whether through debt or revenue, to accomplish that strategic plan. And so that's when it became very clear to the 21 members of the advisory group we needed to move to a different direction. So we sent out an RFP, request for proposals, got 6 really outstanding proposals from some of the leading medical centers in the Southeast. At that time, we evaluated partnerships, just pure partnerships like joint ventures, those kind of things, and a restructuring, which was our second option of doing it still on our own, but with some help. And we found that gave us some flexibility as far as what we could do, but it did not answer the resource question. And the resource question, as I mentioned earlier, deals with money, but it deals with technology, infrastructure, a whole myriad of things. So as we evolved through, we came to the conclusion that we needed a partner through, and it became very clear that an asset sale, which creates the partnership with the New Hanover Regional Medical Center, and in this case, Novant, who's our eventual partner, came to be. And so as we were looking, we narrowed the 6 down to 3, and you would have been pleased with any of the 3, but Novant clearly came to the top. We had a very structured process that we evaluated the medical centers on. It was founded on the strategic plan, had 10 goals developed into 18 key elements, and we evaluated in a very systemic manner all 3 of the finalists on all 18 measures. And I will say that Novant came to the top on all of them. And so at the end, we as you know, we had a unanimous recommendation. And in today's world, politically or otherwise, getting a unanimous recommendation on anything is very rare, but we did. We're very proud of that because the facts and the data and the information led us all individually to the same conclusion. And so that brought us to Novant, and we're really proud and really pleased to have them as our upcoming partner. And so with that background, I'll turn it over to our future partners at Novant. Jesse, if you want to kick it off, or Shelburne.
Spence, thank you. And it's really a pleasure to be part of this group today. I don't know that I'm young enough to make the cut to be one of your members, but I'm impressed with some of the things that you're doing in the community around networking and other things. So my role, as Spence mentioned, I'm Executive Vice President, Chief Consumer Officer for Novant Health. My pedigree, like Spence, is financial services. I spent 25 years with a company that was NCMB, Nations Bank, and now Bank of America, and actually served on the board for Novant for a number of years. And when Carl Amato, the current CEO, became president CEO, asked that I would help and join the organization and leads a number of areas for our organization: marketing, communications, community engagement, and just a number of business areas. But I tell people that I am as proud today as even the first day I joined this organization because of the focus of the organization. Just to tell you a little bit about us, we are a not-for-profit healthcare system that really exists to improve the health of communities. And we like to say we want to improve the health of communities one person at a time. And what that really means for us is that the only way you can improve the health of a community one person at a time, it means you have to be proximate. You have to be in the community. You have to understand the needs of the community. You have to have a lens of health equity. And that's a major part of what we do at Novant Health. We have nearly 700 locations, including 15 medical centers, and we're committed to delivering what we talk about around remarkable patient experience. And that just really means that every dimension, every time, that just really means that every contact point, whether it is through email or virtual visits or through any contact you have with us, we want it to be a remarkable experience. And we do that through listening to consumers. We are a consumer-centric organization, which means that we respect you enough as consumers to listen to the things that are important to you and make that a key part of what we do at Novant Health. We're proud to partner with New Hanover Regional Medical Center, an impressive leadership team, an impressive organization. As Spence has mentioned, we brought dollars to the table, some $2 billion in cash, and we have committed to fund 100% of the strategic plan. And so we're proud to be here today. And with that, I'm going to turn it over to my team member, Shelburne Stevens.
Thank you, Jesse. Good afternoon, everyone. I'm Shelburne Stevens. I'm just across the river from you, down at Brunswick Medical Center. I'm the president here and have been for the last 8 years. I've been with Novant Health now 30 years. Started my career out as a respiratory therapist at the bedside and been in leadership roles for the last 20. But I'm really excited about this partnership for what we're going to be doing for the region. As Spence said on the strategic plan that the Board of Trustees has to create access, and not just all of it at 17th Street either. We've got to figure out how we keep up with the growth in the region between Brunswick County, New Hanover County, and the surrounding. It's going to keep growing, and how we provide access near home and keep the communities healthy, as Jesse pointed out, and also create affordable health care. One of the things that is exciting that we're bringing to the table is our robust charity care. New Hanover had a charity care policy already, but we're going to make that a little more robust with a family that has a household income that's 300% of the federal poverty level and don't have insurance are not going to receive a bill from us. And what that means is a family of 4 that doesn't have insurance, if their household income is less than $78,000, they're not going to receive a bill. So that's really going to help a lot of people in this region. So I'm just really excited about what the future holds for the region and how we're really going to change healthcare around here for decades to come. So Spence, I'll give it back to you. We'll start with some questions.
Sure. Thanks, Shelburne. Thank you, Jesse. And so we will open it up for, I'm off mute, aren't you? Yeah, we will open it up for questions. And listen, y'all are the young professionals, and as Jesse's younger than I am. I don't qualify for the young anymore. I'm trying to be professional. So my technical skills are probably less than y'all's, but I'll monitor the chat room. So if you want to put a question there, I'll try to look at the scan the video. If you want to just raise your hand, I'll try to get to that too. Or if that doesn't work, just butt in. So there is one question. Jenna put a question. It's a fair one. What is the main pushback you've been getting from the community? And I think from my perspective, and I'll take a stab at it and then ask Meade and Bill to give their perception. But my perception is 2 things. And one is not really a pushback, but one of our main challenge is communication, is getting the message out, getting the information out, because we spent 10 months in meeting after meeting after meeting of detailed information that we've absorbed. And we have so much more information that has brought us to our recommendation that the community just doesn't have. And it's all available on our website. But we think it's just so important to do meetings like this, to reach out, to try to get the information into everybody's hands so that they can they can make their own personal, judgment on whether this is a good idea or not. We certainly think so, and as do the county commissioners and the board of trustees. But I think one thing that does surface to the top, it is surfaced to the top as a question for every member of the advisory group, and I think a lot in the community, is as we transition, or early on, if we transition, and now as we transition, do we lose local operational input and control? Because we have a county-owned hospital that's owned by New Hanover County that serves 7 counties, which is a little unusual situation, but it is governed by, a local board. And so as we partner with still a nonprofit, but a bigger nonprofit that has other markets, will we as a community lose operational control? And I think as one of the members of the PAG, and I'll misstate this a little bit, but he had a good point. He said it's important to us as the advisory group in the community that the people making the decision on staffing the emergency room need to also be the people that are dependent on that emergency room for their family. And I mean, that hit home to me. And so we took that message on, and with all of the finalists, we had just very deep conversations about that. And that's one of the areas that Novant just rose to the top and said, wait a minute, we want to be a partner with y'all because of who you are, what you've built, and what you developed. And so in their proposal, they have proposed a very strong local operational board that will oversee virtually all the operations of New Hanover Regional Medical Center as a part of Novant going forward. And we've heard it from other partners that have joined Novant over the years that has worked so effectively. So that's one of the things that we saw early on that we asked questions about, and the community did too, that I think Novant has really stepped up. And so with that, Bill or me, do y'all want to add to that?
Yeah, I'll add a little bit. I do think it clearly is the pushback. It's not pushback, it's why are you doing this? And the people that I've had approach me and say, Bill, help me understand, and I'll take time and I'll walk them through very much what we are doing on this call. I'm batting 100%. They say, now I understand, I support you. So a lot of my business friends that just haven't kept up with the details of this, that they say, okay, I get it and I support it. And that is why this forum right here, what we're doing today, is so very, very important. And hopefully you will have a better understanding. Hopefully you'll find that you believe we're making the right decision, and that you will share that with your friends and family and people you associate with.
Thank you, Bill. That's right on point. Mead, any other comments?
And there are some questions in the chat box, so we'll go right there. But I think that's definitely still the main thing. I think it was this initial shock that that people in the community had about, why would you be doing this? Things are going so well, which they are. And we're definitely at our strongest point, probably as a hospital, and we've all seen the expansion if you've been here for any time. But we were limited. We were very confined, and that's something I had to learn and understand about what it meant to be a county-owned hospital and what restrictions that put upon us for borrowing, for expanding, to going outside of the county. And it very much, that was education. It's a lot of education, the whole industry, certainly. And I had also heard my husband, who's somewhat in the industry, talk about value-based services for several years, and really, peripherally listened to him, what was going on in their world. But it was the first time that I understood why value-based services were so important, and that I did not think that we had the infrastructure, the borrowing power to be able to implement the health equity programs and other initiatives that needed to take place that were part of the strategic plan to change with the times and adapt to operating from fee service to value-based service, which will keep the costs down for everyone in our community. So there was a whole lot to learn and a whole lot to find out. But I would just say that it is worth visiting the NHRMCfuture.org site to see a lot of the stats and the information. But really, what was my biggest driving force behind change was when Novant came forward with the strongest health equity solutions that I saw across the board and have been recognized nationally for health equity solutions that therefore get everybody up to a level in value-based services that will can manage and decrease cost actually for all, or in this very sort of volatile medical arena. So I will just say that it was very much a learning experience, and I came in the same thing, and the only reason I accepted to be on the PAG was like, well, somebody's got to do this, and somebody's got to be from the nonprofit organization, and I am very invested in my community. I was actually born at New Hanover, had a couple of children at New Hanover, was a candy striper at New Hanover. So I mean, like, this goes, like, it goes deep. I mean, I didn't put up money behind it, but I've invested, our family's invested, and all of us will live in that emergency room situation that that was mentioned by Spence. And you know, I remember 17 years ago when my dad first had cancer, that service couldn't be provided here. 17 years later, when he had cancer, that service was happening here. And I know that that needs to happen in more areas to reach our local, or not like 7-county area, not just New Hanover County. So I'd be happy to talk about any of the health equity programs, but I think if Jesse and Shelburne want to share some of that, because there's a question in there about homeless, veterans, and I think there's so many great programming going on already, and that we will adapt to what our needs are here, but our needs are not very different from other areas of North Carolina. And what's really interesting to me is the data science behind Novant. I'll just point that out because that stood out to me, the investment of linking what we all hear about Epic as a healthcare system, a medical record system, and we're like, what does that mean? But then they went another step further to link it to a program that identifies gaps and demographics and really makes the data usable to come back out into the community and establish programs and initiatives and track them, make them measurable. So that's my spiel. And I'll get to the questions.
No, well, thank you, Mead. That's excellent. Thank you for that insight, and you've been providing that insight for 10 or 11 months, and we really appreciate it. And as Mead said, we've got several questions in the queue, and some of them lead together. And so I'm going to kind of pack a couple of them together and then turn it over to our partners at Novant, because they're really dealing with health care and health equity, as Mead said. One is from Dorian, who says, I'm a veteran, and thank you. Let's just pause and say thank you for being a veteran, Dorian. But I would like to know how health care with Novant will differ from New Hanover Regional Medical Center. And then there's also from Stacy, can you speak to the main points of health equity? Because I think that health equity is a part of the advancements I think we'll make as we partner with Novant. But maybe Shelburne, maybe I'll just move it to you, and we'll talk about, what will be the same as far as healthcare, what might be enhanced as far as healthcare with New Hanover Regional Medical Center. And if you and Jesse could make a comment about the health equity, that'd be helpful.
Sure, thank you, Spence. So nothing's really going to change about the services at New Hanover unless John and his team and his board want to change services. Nothing will change, but diversity and inclusion and health equity is at the core of everything we do. And with that, we have some business resource groups within Novant Health, and one is centered around veterans. How do we take care of our veteran patients? How do we reach out to them and make sure they're getting the health care they need, and also our own team members. So we'll continue to work to assess veteran services and how could we expand that and move that out to the community. And health equity is really making sure everybody has access to good quality health care in their community. Transportation is sometimes a barrier. They can't get to everything. And we mentioned earlier, everything can't happen on 17th Street. So we've got to look at, with the growing area, how do we provide primary care access, have clinics, for those underserved communities or people who just don't have the ability to get there, and help them on their wellness journey. Again, our mission is to keep communities healthy one person at a time, and that's all community members. So we're really going to be looking at how do we improve health going forward in the 7-county region, not just in New Hanover County or Brunswick. It is all around to really support this growing area that's coming here. And I saw one around businesses, a question around selling a hospital, does it affect businesses? We've seen businesses grow at Novant Health around our markets. One of the things they look at in our community is school systems and healthcare for them to come bring business here. And so we anticipate continuing on that journey and providing excellent care that New Hanover's done. More businesses will be attracted here. So Jesse, I'll pause. Anything you want to add I left out?
No, I think you did a good job covering it. You know, what I will mention is that it's very intentional on our part. And to the question around some examples of health equity, you know, it could be something as simple as understanding, as we're looking at data, that there's a high propensity of high blood pressure or diabetes in an African-American community, and a partnership with a church, our local organization, to baseline some of the members of the church and start working with the members of the church to impact that particular community. Or it may very well be that we see that within our population that there is a gap between Asians and Latinos in getting mammograms versus the majority community or African-American community. And the work that we will do there intentionally, understanding that there may be some cultural differences, understanding that we can bring language as part of helping the Asian or Latino community to better understand why it's important to get mammograms, and specifically looking at closing the gaps there. What we have found is that when we improve the gaps in any one of these segments or racial groups or ethnic groups, we elevate the improvement of health with all of our ethnic groups and segments within our business. So those are just a couple of examples of some of the things that we do.
You know, in combining some of the, you know, in our due diligence, you know, I can't speak from the Novant side, but I can speak from the advisory group's due diligence, because we got inside the collar of these guys, you know, when we were doing the due diligence to ask a lot of questions, and health equity was at the top of what we do. And there was a question here about the homeless population, which certainly falls into that category. You heard Shelburne mention earlier, you know, New Hanover Regional Medical has a level of charity care. Well, Novant's charity care is 1/3 higher. And if I misquote these numbers, guys, y'all tell me wrong, but I believe for a family of 4 with no insurance and income of $78,000 or less, that Novant will send no bill. It's free service at the hospital. Think about that. I mean, family of 4, $78,000, if they happen to not have insurance, get free service under Novant in our community. And that jumped out to us. Second thing that jumped out is, and they hadn't tooted their own horn, and they should, is that Novant, and I can't remember the accrediting agency, but they were awarded, I believe it was the first health equity award nationwide for their programs in health equity in some of the things that they have done. So in our measurements of I mentioned we had 18 points, Novant rose to the top in you know, Jesse mentioned too, data analytics are critical in getting into the areas of identifying where the gaps are in health in our communities. Because as we go forward, we learn very quickly that we've got to go from treating health issues to helping create healthier communities. And Novant has been on the leading edge of that. And that, in the due diligence anyway, that really raised them to the top in a lot of our perspectives. There's a financial question in here, and I always migrate to those, and I can't answer it fully, from Reed, and it deals with the pension, and it has some specifics in there that I really can't answer, but I'll try to address the pension as best I can. And Bill and Mead, if y'all want to jump in and help me out, that'd be great. But you know, New Hanover has a defined pension, which is a unique pension through the ownership of New Hanover County. It is a governmental type pension that by definition will have to go away because New Hanover County will not own the assets of the organization anymore. And so it will, the pension type focus will evolve into Novant and how they handle their retirement functions going forward. And I can't address those, but I can address in the transition that the Board of Trustees at New Hanover Regional Medical Center have been intentional and are including it in the letter of intent and the definitive agreement, a amount of money to help transition the pensions for those who are like me or closer to the finish line than the beginning of careers, you know, to make sure that they are not harmed financially by this. And so there's a part of the money that Novant has been gracious enough to provide New Hanover County is going to be set aside for that transition to help in that process as they transition out of the current pension into the Novant retirement. Let's see what else we have here. We touched on, you know, we touched on the business aspect. Through our due diligence, we are convinced with Novant as a partner and the advances that they're going to help us make in our community with the investment, not just up front, but over 10 or 15 years, the investment in the capital structure of the medical center. You know, and Bill and his family have been leading business people here for years. I might let him address it, but from an economic development standpoint, I think there is a lot of excitement about the opportunities for future jobs for higher levels of employees to be a part of our team down here. And then of course the tentacles go way out into the community in that, you know, we have 7,500 employees already. Bill, do you have anything you want to add to that from an economic development standpoint?
Yeah, I think there are maybe 3 points that come to my mind. One, just the expansion of facilities in our surrounding counties that will come as a result will clearly make those rural counties more attractive to employers coming in, whether it's Brunswick or Pender or wherever. But that will certainly be a positive. The additional services that you get, just I'll call it bench strength, maybe as a poor choice of words, but at least it's a choice of words. But the strength of the team by partnering with Novant, that's going to be attractive to any employer that's looking at our region. And then I think a third thing that is really interesting that we have not spoken about is through this partnership, we're expanding the relationship with the University of North Carolina School of Medicine. And that program, we will expand the capacity of residents here in Wilmington. We will expand the capacity of the medical students, and that's 2 different programs. But the 3rd and 4th year medical students that will be here in Wilmington. And those will be economic drivers for the region by the expansion of those programs and the expansion of our relationship with the University of North Carolina School of Medicine. So I think in multiple ways we're looking at this, the economic benefit from recruitment of industry is a positive.
Thank you, Bill. Mee, did you have anything for that? Or?
I just think the UNC thing was pretty much the clincher. That was what I was going to mention that it had not been mentioned already, is that, I mean, I am a UNC graduate, so obviously I'm very encouraging of that relationship. That relationship did not exist with Novant. We already had a relationship with the hospital, with our hospital, as Bill mentioned. So this is going to take it to a whole nother level of feeders, of professionals, of families coming to our region. And then I think it's rather proven, and I'm never going to mention statistics around this, but how just the UNC system people tend to stay in North Carolina. They tend to return to North Carolina to work versus if we were partnered maybe with another school that was outside of, you know, our state. So I think that is going to be huge. I know too that, I mean, I defer directly to obviously the physicians and the physician groups and all of those, and they could not speak highly enough, all of the physicians wholeheartedly, and they looked at this process as closely as the PAG, the Partnership Advisory Group, did. They had their own group and were working simultaneously, and so really deferred to them with all their expertise and inside knowledge and about what that would mean for us to have Novant and UNC as a part of this partnership. And they couldn't say enough about how that will help us expand our services.
That's great. Thank you. And thank you for bringing up that point. That partnership with UNC is just, we were all excited when that rolled about. So thank you for bringing that up. For sake of time, there are three questions that are sort of connected, and I'm going to try to bring them into one discussion point if I can, so that we can get through them. One is, what are the specific plans for expansion now that Novant's coming on board? How will the hospital be expanding? And another question deals with Pender County, and as most of you know, we have a contract with Pender Memorial and is operated out of New Hanover, and how it's going to affect Pender Memorial and other feeder type operations outside of the sole focus. And then there's also a question about, which we all know, there's not a lot of vacant land left around Wilmington and around the hospital, and is there any way to add facilities to the hospital? So I'll kick that conversation. So it's basically an expansion and how that's going to happen. Now I'll kick it off, and then any of the other panelists clean up the mess I'll probably make with it. But the strategic plan is very specific. One challenge is the strategic plan is proprietary and has some information in it that is not, from the Board of Trustees perspective, ready to present publicly all of it. But I will say this, directionally, as I mentioned earlier, the strategic plan a lot of it centers around getting health care to the population instead of the population coming to 17th Street. So it involves building what they call ambulatory services, which are clinics in underserved areas, clinics in rural areas, clinics in areas where people can go to get primary care without having to come to 17th Street to the emergency room, which is the most expensive delivery of health care that we have. So there's a lot of the strategic plan deals with that. As most of you know, the Regional Medical Center has bought a good-sized tract of land right on the New Hanover-Pender County line, and that was strategic. And we obviously have some operations up there. There is some discussion about building a second hospital to serve that area, which gets into the Pender County area. Frankly, just historically, the reason that was purchased right there is because one of the limitations we have in our current structure is we can't borrow money in New Hanover County and invest it in Pender County or any other county. So we got as close as we could get without stepping across the county line. But the Pender contract and arrangement will continue under Novant. We'll continue running that. The strategic plan calls for a lot of upgrades in those fast-growing areas. It has some discussion of potential, and I'm saying this because John Gistic said it publicly, so I guess I can. One of the things they're considering is, do you build another hospital just like we have in Brunswick County on the Pender County line? Well, that costs some $250 million, which is, as you know, that's more than the 150 we could borrow. But those plans are there. So there are specific expansion plans that deal with getting health care to the population, as opposed to population having to come to a center place for it. So Bill, Meade, anything else on that?
Whoops.
I would just say, yes, the whole ambulatory, taking it out to the rural environments, which Novant has been dealing with more rural areas probably longer than we have, but also the telehealth piece, which due to COVID has grown exponentially, kind of got pushed to the forefront maybe faster than some people were ready for it. But I think that we saw that from the beginning was that Novant was ahead of us from the telehealth piece and able to respond faster in COVID than we could respond. So we're really looking for those strengths to be able to roll out, especially to the rural areas, or when you can't get out for multiple reasons like today, or why you shouldn't be out type of thing. That is needed to be expanded even beyond the ambulatory services. And I think the right now, the Department of Health is being, which is next door to the hospital, is being torn down. Because you're right, around the hospital, there is nothing there. And we also have a parking challenge like you do anywhere downtown or anywhere. So the idea is to pull people away from coming in on 16th, 17th Street into that hub. So that's always, I think that's a big part of the strategic plan and a big part of going outside of the county.
Bill, anything else?
Well, I'll address that question on that talks about an advisory body. Well, the governing documents of this transition require that the bulk of the members of the Board of Trustees will be from Wilmington and will include, I think, at least 3 practicing physicians that are practicing at the hospital on that board. And that's an ongoing item. That is not a transition item. That's a permanent item. And further, as part of the deal, 2 people from New Hanover County or from this region will actually go and serve on the parent board of Novant, which just shows that what they're trying to do is they're saying, hey, we're partnering with them truly in the truest sense. We're going to be part of them. They're going to be part of us, and the local control will be ongoing permanently.
Thank you, Bill. And I think that's a really good point. You know, I mentioned it earlier. That's where Novant really came to the table and stepped up and said, we want the local board to run this hospital. So most, if not almost all, Jesse, of the operational recommendation decisions will emanate from the local board perpetually going forward. The hiring and firing of the CEO and the team and the starting new opportunities or eliminating things that we do has all got to emanate locally, not being directed from somewhere else. And so we were really pleased with the level of local operational authority and oversight. But again, we didn't have to drive that. Novant drove that because he said that's a good business practice, is the way they do business.
Spence, you're absolutely right. In our view, that's really part of the secret sauce. You know, New Hanover has a phenomenal leadership team. And, you know, to Bill's point, when we come together, there's no more them and us, it's us. And the recommendations that will be coming from the local leadership team and the local board will elevate, you know, to the parent board, which will be represented by leaders from this region. And as I shared with the call earlier this week, I'm not aware of a recommendation that has come from the leadership team of a market and supported by the board that wasn't supported by the parent board. So we were very open to that because of the talent of the team and the great opportunity in the market.
Right. Any other input from the panel on the board? We have one other question that's come up. I'm going to shift it. The question is, assuming there will be redundant operations in the administration departments of both organizations, what will be the anticipated reduction in force? In other words, job layoffs. First off, in the letter of intent, and it will survive into the in the final contract, there is a specific commitment from Novant to have no reductions in force for a period. And somebody correct me, I think it's 2 years. Jess, you guys might need, I think that's 2 years. So regardless of the situation, no job loss because of redundant situations or any others of that nature over a 2-year period. You know, moving forward, our anticipation is with this partnership, there's going to be so much more opportunity down here because of the extra services and the outreach. And anytime you invest $3 billion in capital to build and expand, we got to have people to operate these things. And so the expectation over time is that not only are we going to maintain our workforce, it's going to expand greatly. And that's been proven out in other areas. And so we're very confident that that's going to happen. Jesse or Shelburne, anything from y'all's perspective?
No, Spence, I think you nailed it. I mean, we're excited about this market. This is a market, as you know, that's going to grow from some 400,000 people to close to 1 billion people over the next 20 years. We see the Wilmington area as a destination. There's no way we can invest $3 billion in the market without hiring thousands of people to support the clinics within the communities, the new medical centers, and all of the things that we're going to need to do in the market. So we see this as an expansion opportunity. We see it as a growth opportunity. So I don't think there's any risk of there not being more opportunity in the market.
Right.
I think there's another point to be made. There are certain people at the hospital that I would speculate they're happy in their job. They're not looking for career advancement, climbing a corporate ladder, let's call it. There are other people who have the opportunity to maybe move up. And I think the partnering with Novant will open up avenues for advancement for a lot of people in our organization that they would not have had otherwise, or they would have had to leave the region or whatever. So I think for those that are looking to move up in corporate structure, it actually improves their opportunities.
And adding to that, one of the things we haven't said is the structure of Novant is fairly decentralized. Actually, they have a hub model where they have a hub in Winston-Salem, hub in Charlotte. We're going to be a third hub. We being the region, Shelburne's group in Brunswick, New Hanover, and the 7 counties we serve are going to become a hub of this area. And there, this area is significant, as Jesse said, and we all know what's happening in southeastern North Carolina and what the growth will be. So I think Cedric Dickerson, who's a member of our advisory group, said it very well. He said when we were talking to the 3 finalists, they all treated us. Gosh, how did he say it? They all treated us. What did he say?
I think they said they all treated us like a jewel.
Right, yeah.
But
they all treat us like a jewel, but Novant treated us like a priceless gem. And, we really felt that. And one thing I will say, not getting off point much, is in our due diligence, all 3 of the finalists were outstanding medical health centers. And in our due diligence, we really evolved and spent a lot of time talking about culture and will this thing mesh? Does this thing work? And when you look at the mission and vision of Novant Health and look at the mission and vision of New Hanover Regional Medical Center, they're almost identical. You can just lay them on top of each other. And so we found ourselves in our due diligence sessions with Novant, felt like we were talking to hometown folks. I mean, we felt like we were talking to ourselves, so to speak, in that. And I think as we transition, every one of these questions deals with culture in one way or the other. Everyone deals with that, and that was so important to us. We're getting close to the end of our time, and Barron just put in a really good question that the advisory group was not tasked with dealing with up front, but it found its way into our letter of intent. And it said that what are the plans for the proceeds from the sale? And as you heard Jesse say, the proceeds really are about $2 billion, a little less than that. It's $1.5 billion that's going to come directly from Novant, and then another hundreds of millions of dollars that will be freed up, that is actually cash of the current medical center that will be turned over to New Hanover County. So the total is just under $2 billion available to the citizens of New Hanover County. That's a huge number. Very quickly, some of it, as I mentioned earlier, is set aside as a transition for the employees from New Hanover Regional Medical into Novant, where that deals with pension, any other transition issues. So there's a block of money set aside for that. When I say a small block of money, if you think $100 million is a small block of money, set aside for just contingency issues in the transition, just to make sure, going forward, if there's something we all missed, that's going to be set aside and escrowed, so to speak, from that purpose. The county is setting aside a certain amount of money for I believe what they call revenue stabilization fund, I think, and it's a fund that will be set aside for, it's a rainy day fund. You know, hurricanes hit, you know, issues hit that instead of having to go right to the taxpayers, we can draw on the dividends and the income from that money they've set aside. But the vast majority of the money, $1.25 billion, $1.25 billion is going to be set aside in a separate community foundation, separate from the county commissioners, separate from the hospital, that will be governed by a separate board of community members that will use the proceeds, not the principal, but the proceeds of that money each year to reinvest into New Hanover County in areas such as housing, law enforcement, education, and certainly healthcare, which is at the top of the list. So, you don't, even a simple mind like me can take 4% off of $1.25 billion and come up with a whole lot of money that's going to be reinvested into our community. You know, it's many times what our United Way, everybody here probably participates in United Way at one point or another. It's many times, several times what the United Way is able to provide into our community. And so, and we'll be able to do that without touching the principal. It will stay perpetually 1.25 billion or grow from there. So we're really excited about that. I'm proud of the county commissioners. Since I've sat in the political seat before, I can say this, that it is not common for elected officials to give up power or money. And in this case, the county commissioners have done both by creating the community foundation. So, Meade, you work a lot in that nonprofit world. That a lot of it could be the beneficiary of this. Do you have anything else from that?
No, just that it's such an outstanding opportunity. I mean, for multiple generations. So I do think that this particular moment is so essential for what is the future lays ahead. So none of it is short-sighted. It's all very long-term. Where do we go from here? This is not about even, yes, it's about who we all are here and who's working at the hospital now and where we exist. But this, it really is, it's a long-term strategic plan, but it's a multi-generational plan and for the longevity of our county and our region. So, and of course, I'd like to see some of that money.
Yeah, that's right. Well, thank you, Meade. And listen, and Bill and Meade and Jesse and Shelburne, thank y'all for your help today. I see we're getting right to 1 o'clock. I want to thank all of the young professionals for your interest in not just this, but what you're doing for our community. You know, as Jesse was kind to point out, that he and I may not be in the young area anymore, but y'all are, and y'all are our future. And y'all are going to be sitting on this advisory group at some point. It may not be about the hospital. It may be about something else in our community. So thank you for so many of y'all. So for that, Jenna, I'll turn it back over to you and close us up.
Yeah, thank you so much. I know I just learned a ton. I feel like that's probably the consensus. And also I'm glad that you guys had so many great questions to bring to the table too. I guess in closing, we will be emailing this recording to everyone. There is a live video shared on our Facebook page where people can go back and rewatch it, especially people in real estate or in recruitment. I definitely think your friends in that area would be even more interested in this as well. And then where can we send any follow-up questions?
Yes, I should be. Let's see. I'm drawing a blank on our email address. Carolyn, are you with us? Can you chime in?
There's a form on the NHRMC Future website where you can submit questions. You can also find all the past information, presentations, and sign up for email updates for future articles and videos that are shared through the site.
Right, and I think if you look over on the chat, I think Jenna put the website information there earlier. Scanning back to see if I can find it. Yeah. Jenna put it as NHRMCfuture.org. NHRMCfuture.org. Okay.
Well, thank you all for your time. Sorry for the hiccup in the beginning, but I think it went great, and we appreciate you guys and all the work that you're doing for us.
Thanks, everybody.
Thank you for the opportunity.